you. Senator Wyden.
Thank you very much, Mr. Chairman. Dr. Adams, do you agree with Secretary Kennedy's approach to dealing with the measles epidemic? And I would like a yes or no answer. I know time is short and you and I got a lot of stuff to cover. Do you agree with Senator Kennedy, the Secretary's approach to the epidemic?
Senator Wyden, as we talked previously, there's more measles cases in Mexico and Canada. So we've had one case in Idaho. It was a Canadian who flew into Salt Lake, drove up to Idaho, sequestered, generally compliant.
I asked, do you agree with Secretary Kennedy's approach to the measles epidemic? We have the highest number in 30 years. That's why I'm asking for a yes or no answer.
Senator Wyden, I was describing our case in Idaho. We got white glove service from the CDC. We were very grateful for the federal support that we got. Secretary Kennedy has advocated for the MMR vaccine as the most effective way of preventing the spread of measles, and I agree with that.
I asked you twice to tell me whether you agreed with his approach on the measles epidemic, and clearly you do. And I think that is bad news for America's kids and families. So let's talk about the residential treatment facilities that you and I talked about. As you know, and I gather you read our report, Warehouses of Neglect, it finds that federal restraints and seclusion regulations are often overlooked, that there's often unqualified trained staff, and it's hard to have the oversight that's necessary. So my question here is, what are you going to do specifically to stop kids in residential treatment facilities from getting hurt?
Senator, I appreciated our conversation on this the other day. I think it's an area where you and I have a lot of thoughts that align, and I look forward to working with you on this topic if confirmed. What we did in Idaho was we followed the lead of your Warehouses of Neglect report, as well as the spirit of the Family First Prevention Act. We want to use congregate care as a tool of last resort, and for the shortest amount of time, only when it serves a therapeutic purpose. When I started at our state HHS agency, I had 268 kids in congregate care. Today, I have 173. We reduced congregate care 35%. We talked about regulation and zero-based regulation. Another way of saying it is right touch regulation. We want the right regulations where they make sense.
I'm still not clear what you're going to do to keep kids from getting hurt in these facilities. Like, for example, would you use independent investigators to make unannounced visits to facilities if there was some concern that the kids weren't getting decent care?
Senator, so the licensing of residential facilities is at the state level. There's three ways in which these facilities intersect with an agency like mine. There's licensing, Medicaid provides.
It's just a policy. I want to get a sense, because when you talk to me, you made it out like you were up and down supporter of the work that we've been doing. Now, if you find out you agree with Robert Kennedy about, measles, I want to find out what you do if there was a facility that was, problematic, whether there'd be unannounced inspections. And so why don't you answer that question, if you would?
Senator, I'm building up to that. So we have Medicaid provider agreements as well as child welfare contracts. What we do is, since I started, we went from one announced inspection a year to 2 inspections a year, including 1 unannounced. We now randomize the inspectors in Idaho, and the reason we do that is there's no greater need than to protect the most vulnerable kids, and the most vulnerable kids are those in congregate care settings. So I do believe those are very appropriate decisions for states to make. I think the role of ACF is to follow the spirit of Family First, provide best practices, provide guidances to states, and then I think through the 4E dollars as well as the Medicaid dollars.
Answer my question. I believe you have said on occasion you use an unannounced inspection. Is that right?
That is something new that we've done in Idaho since I started.
I have one last question, and my time's going to be up. We're adding to the report that you read that sets out specific abuses against LGBTQ young people that we have been able to document. We've collected over 100 personal stories, and it's clear these kids suffer from extreme isolation in facilities. They get verbally abused. Often they face things withheld from them that doesn't apply to other young people. What would you do to make sure that the laws are complied with and they are treated with dignity?
Senator, it's simple. All kids deserve respect and dignity.
So what would you do, though, given the problems that we've documented? Would you make special efforts to reach out? I mean, you are very articulate. You were very articulate in the office, but it's really hard to understand what you stand for and what you would do. These are kids who are being discriminated against now, right now. 100 cases, we've documented them, and you say all kids deserve, a fair shake, but I don't know what it is you would do to make sure they got one. So why don't you take one more crack at that?
Senator, my operating principle in Idaho has been when there's a fork in the road, I'm going to do what's in the best interest of the child. Not knowing the cases, I'd be happy to review those cases. But following the best interest of the child and ensuring all kids are treated with respect and dignity and protected from harm and following the law is my operating principle.
Thank you, Mr. Chairman.